Okay, so we'll talk about the joints or articulations. Joints are also called articulations. First, we'll see the classification of joints. We have many different types of joints in the skeleton. So we'll see how we classify the joints. So he cannot walk. Okay, so this is the skeleton and the bones. In adult skeleton, we have 206 bones, and they are attached to each other to form the skeleton. At the joints, the bones are attached to each other. So we'll see how we classify the joints. Okay. One type of joints is called synovial. Synovial joints are the most common type of joints and also the most flexible type joints. That means in synovial joints you have plenty of movement, can move a lot. Okay, so most common and most flexible joints are, or most movable joints are, the synovial joints. Okay, so we'll see the structure of a synovial joint and the properties. Then we'll talk about different types of movements that occur at the joints. Then we'll talk about a couple of large synovial joints. For example, the knee joint and shoulder joint. Those are big synovial joints. We'll see those joints. First, what is a joint? Joint is a structure where two or more bones unite or meet. And joints are the locations where we move our body parts or bones. So, joints are the locations where two or more bones unite or meet, and joints are the locations where we move our body parts. Now, joints could be different types. We divide the joints in two ways by looking at two different things. We classify the joints by looking at the amount of movement, and that is called functional classification, because we know that function is the movement. So functional classification. Another way we classify the joints by looking the structure in the joints. That is the structural classification. Structural classification. Okay. So by looking at the movement and by looking at the structure, we classify the joints. By looking at the movement, we classify the joints into three types: synarthrosis, amphiarthrosis, and diarthrosis. Okay, so three types by looking at the amount of movement. synarthroses are immovable, no movement. Example, you see here, your skull bones are attached to each other by sutures. And for example, this is your parietal bone, this is your temporal bone, this is the suture attached to these two bones, parietal and temporal, and no movement occurs in the sutures. Make sense? We cannot move the cranial bones. So, synarthrosis. Amphiarthrosis, small movement. Example, when you breathe, you know that ribs move, right? Like this, the ribs move, but not a lot, slight movement. So, ribs are attached to the sternum and small amount of movement occurs there, amphiarthrosis. Diarthrosis, it's a slight movement. In diarthrosis, lot of movement occurs. For example, shoulder joint, right? You can move a lot. Elbow joint, we can move a lot, right? Knee joint, hip joint, those are diarthrosis. Plenty of movement occurs, okay? Structural classification. By looking at the structure inside the joint, we classify into three types: fibrous, cartilaginous, and synovial. Synovial. So, three types of structural. Fibrous, you can just tell by its name, the bones are connected by connective tissue fibers. That's why those are called fibers. Cartilaginous, bones are connected by what? Cartilages. Make sense? Cartilage. That's why called cartilaginous. Synovial, bones are connected by fluid. Synovial fluid. Cavity contains fluid. So there is a gap in between the bones, and synovial fluid fills the gap. Is it clear? So fibers, cartilaginous, and synovial. Now, I mentioned that synovial is the most common type and most freely movable joints. Because now you understand, if you see, if you have two bones, these are two bones, and there is a gap filled with fluid, right? You can have a lot of movement there. Makes sense? But if they are connected by fibrous structures, not a lot of movement is possible there. Makes sense? Or if the bones are connected by cartilage, not a lot of movement is possible because they are connected by cartilage, hard structure, right? But if there is a gap, a lot of movement is possible. Okay? So synovial is the most freely movable joint. Okay. Now, fibers could be three different types of fibers. Okay, let's see what are those three types of fibers. Sutures, syndesmosis, and gymphosis. So fibers, three types of fibers: sutures or sutural joints, syndesmosis, and gymphosis. Okay, so these are three types of fibers. Sutures, I have already shown you. Sutures hold the skull bones. So most of the skull bones are attached to each other by the sutures or sutural type fibrous joint. Is it clear? Syndesmosis. In syndesmosis, the bones are connected by ligaments. Let's see the sutures first. So you see the cranial bones are attached to each other by sutures. Now if you see the structure of a suture, a sutural joint under the microscope, what you will see, this is one cranial bone, this is another cranial bone. Okay, so two cranial bones are connected by sutures. Now here, inside the sutural joint, you will see very short fibers, very short fibers like this. That's why it belongs to fibers. But fibers are what? Short fibers. Okay, held together with very short interconnecting fibers. Make sense? Okay. Then, if you see syndesmosis, bones are connected by what? Ligaments. And example, distal tibiofibular joint. Here, lower end of tibia, lower end of fibula, leg bones. You know, this is tibia, this is fibula, the lower end of tibia and lower end of fibula are connected by ligament here. That is called distal tibiofibular ligament joint, and the ligament hold the bones together, and that is syndesmosis, because ligament holds the bones. Gymphosis. Gymphosis is present where the teeth articulate with your jaw bones, mandible and maxilla, right? So teeth and the jaw bones, maxilla and mandible. Here you see, this is the bony socket in your jawbone, and this is the tooth, and this is a ligament called the periodontal ligament that connects the bone, root of the bone, to the bony socket. So this is the bony socket, this is the bone, okay, like your mandible, and this is the root of your tooth, this is the tooth, and here you have the ligament that is called the periodontal ligament. So this is a gymphosis type joint. Okay, let's go back. So we can classify the joints in two ways. One is by looking at what? Movement, right? Amount of movement. Another is looking at the structure. So functional and structural, right? Functional includes syndesmosis, synarthrosis, amphiarthrosis, and diarthrosis. Make sense? SAD, SAD, remember, okay? SAD, SAD. So synarthrosis, amphiarthrosis, diarthrosis. No movement, slight movement, plenty of movement. Clear? Okay. Structural classification: fibrous, cartilaginous, synovial. In case of fibrous, the bones are held by fibers, fibrous structures. Make sense? In case of cartilaginous, bones are held by cartilage. In case of synovial, bones are not directly attached to each other. There is a gap filled with what? synovial fluid. Make sense? So synovial fluid connecting the bones. So which one is most freely movable? This one, right? Okay. Now fibers again is divided into how many types? 3. Sutural or sutures, then what? Syndesmosis and gymphosis. In case of sutural or sutures, the bones are held by short interlocking fibers. Make sense? That's why it's almost no movement. Syndesmosis, the bones are held by what? Ligaments. Make sense? Ligaments. And gymphosis is only present where? In the jaw, teeth and jaw bones. Make sense? So bony sockets and the tooth connected by what ligament? Periodontal ligament. Make sense? So those are 3 types of fibers. Now cartilaginous could be 2 types. Cartilaginous could be two types, synchondrosis and symphysis. Synchondrosis and symphysis. 2 types of cartilaginous. Very simple, remember, in case of synchondrosis, the bones are, these are 2 types of what? Cartilaginous, right? 2 types of cartilaginous, synchondrosis and symphysis. So bones are attached by cartilage, right? In case of synchondrosis, the bones are attached by hyaline cartilage. You remember hyaline cartilage? Okay. So if you see that bones are attached by hyaline type cartilage, that is called what? Synchondrosis. Is it clear? In case of symphysis, the bones are attached by fibrocartilage. You remember fibrocartilage? There are 3 types of cartilages, right? Hyaline, elastic, fibro. So synchondrosis, the bones are held by what type of cartilage? Hyaline type cartilage, right? In case of symphysis, the bones are attached by fibrocartilage. Example, you know that costal cartilages are hyaline cartilage, right? This is your first rib, this is the sternum, this is the hyaline cartilage, so this is synchondrosis, okay? Now there is a issue here. What is that? Only first rib and sternum, this is synchondrosis. Although all these other ribs are connected to the sternum by hyaline cartilage, but these belong to synovial. Why? If you look inside, you will see a cavity. If you look inside these joints, you will see what? Cavity filled with what? Fluid, synovial fluid. That's why we consider this as synovial type joint. Okay. Only this one doesn't have synovial fluid and cavity. So just know that. So now let's see 2 types of cartilaginous, synchondrosis and symphysis. Here you see the first rib and the sternum that I showed you. This one is an example of synchondrosis, hyaline cartilage. The upper end of a long bone is attached to the shaft by a thin plate of hyaline cartilage that is called epiphyseal plate. The growth plate that becomes epiphyseal plate, and that is a thin plate of hyaline cartilage, so that is also considered as a joint and synchondrosis type joint. Here you see the bones are connected by fibrocartilage, so symphysis. Example, vertebrae are attached to each other by fibrocartilage, intervertebral discs here. These are fibrocartilages. Make sense? So symphysis. Also this one, two hip bones are attached here anteriorly by this fibrocartilage. That's why this is another symphysis type joint. Make sense? So those are symphysis, pubic symphysis and intervertebral discs. So that's the classification of the joints. Now, the most common type and most flexible joints are synovial joints. So we need to know the properties or characteristics of a synovial joint. Okay? This is important. This is another picture. I may ask you to draw and show the parts. One I mentioned in last lecture, neuromuscular junction, important picture. This is another one. If you see a synovial joint, as I have mentioned, this is one bone, this is another bone, and I told you that in between the bones you have what? In synovial you have what? Synovial fluid, right? That means there is a cavity or gap filled with fluid. So this is the cavity filled with synovial cavity with fluid, synovial fluid. Okay? And around the joint you have the capsule. You know, capsule covers the joint like this. Look at this. This is the joint, okay? This is the gap, synovial cavity, and the joint is wrapped by capsule like this, okay? Around. So this capsule is covering the joint like this. So this is the joint capsule. Anybody remember what kind of connective tissue is that in joint capsule? We talked about that. Dense, irregular. Ligaments, tendons, dense, regular, right? And capsule, dense, irregular. That's the joint capsule. Okay? Anyway, so joint capsule covers the joint. And the capsule has two layers in it. So this is one layer, this is the outer layer, and this is another layer of the capsule. This is the inner layer. Okay, so two layers. Outer layer is fibrous. Outer fibrous, and inner layer is called synovial membrane. So outer fibrous layer and inner synovial membrane. Those are two layers of what? Capsule, right? Capsule has how many layers? Two. Outer one is called fibrous and inner is synovial membrane. Which one should be tough? What do you think? Fibers, right? Those structures have a lot of fibers. Those structures are tough, right? Make sense? And you know, outer one should be fibrous because that protects, right? Always the outer structure protects, right? So, outer one is for protection. Outer fibrous layer is for what? Protection. That makes sense. Tough one, right? Inner synovial membrane does what? Inner synovial membrane is very important because it secretes the synovial fluid into the cavity. So this one secretes fluid, synovial fluid, into the cavity. Okay? So both are important, right? Synovial fluid is like lubricating fluid. Lubricating fluid, makes sense? So reduces the friction between, like you see when we move the synovial joints, a lot of movement, right, occurs in synovial joints. So around the joint, I told you, you have the muscles, right? You have the tendons, you have the ligaments, capsule around the joint, right? So when you move the joints, the chance of friction between those structures is high. Make sense? So the fluid prevents the friction, right? Reduces the friction because what kind of fluid is it? Lubricating fluid, okay? Slippery fluid, okay? So it's like, in your car engine, what do you use? Engine oil, right? Oil. So that lubricates the joints. Now if synovial fluid amount goes down, then what will happen? More friction, right? Will cause inflammation, right? Friction occurs, inflammation will occur. So will cause pain and inflammation, swelling. Okay, so you have the synovial cavity filled with synovial fluid. You have the capsule which has 2 layers, and another thing is the end of the bones, that means the part of the bone inside the joint is covered by hyaline cartilage. So both ends are covered by hyaline cartilage, and that is called articular cartilage. What kind of cartilage is this? Type, its name is articular cartilage. It is a hyaline cartilage. Hyaline cartilage. Okay, so if I ask you what are the structures you will find in a typical synovial joint, these are the structures, okay? And if I ask you to draw and show, if you draw this one, you'll get full point, okay? Now if you get from somewhere else, I may not give you full points, okay? So this is what I want. Make sense? Okay. Not difficult. Okay. Now, in some large synovial joints, you will see another structure, fluid-filled sacs, flattened fluid-filled sacs, filled with fluid. I said fluid-filled, flattened membranous sacs. These are called Parsa. Okay. So Parsa are present only in large synovial joints. That's why when I say that what are the structures you have in a typical joint, we don't include Parsa because Parsa is not present in all synovial joints, only some. That's why Parsa we don't include it. We don't include it. But Parsa are present in some synovial joints. And Parsa act as ball bearing. In bicycle you use the ball bearing, right? Have you seen that? Balls, metal balls that rolls. In some engines we use like this. For example, there is a Parsa here. This is called acromion, and under the acromion you have a bursa that is called subacromial bursa. Sub means under, right? So under the acromion, subacromial bursa. You see that flattened green color, that membranous sac filled with fluid. Now, why you have a bursa there? You see here, when you move your humerus, the shoulder joint, the bursa, subacromial bursa, is between the acromion and the head of the humerus, will roll like this. Make sense? So like this is one bone, this is the bone, this is the acromion. When you move the bone, the bursa rolls like this. Make sense? That reduces the friction as well as increase the flexibility, increases the movement, right? Easily. If you put, wheel under your shoe, if you put wheel, right, you can roll, like easily, you can go fast. So it's like that, okay? So the bursa reduces the friction between the bones, or this is a bone, this is for example a tendon, reduces the friction, okay? So bursa are flattened fluid filled sacs present in some synovial joints. Is it clear? And they roll like ball bearing and reduces the friction and increases what? The movement. Okay? Have you heard the term bursitis? Bursitis is, itis is inflammation, right? Any inflammation is termed as itis. There could be hundreds. So bursitis is the inflammation of bursa. Now if inflammation occurs in bursa, then what will happen? If you want to move, you will feel pain, right? And the movement will be restricted, right? Sometimes burst of bursa can occur because these are fluid filled sacs, right? If something hits strongly, that can rupture the bursa, right? Burst the bursa. So fluid will come out, inflammation will occur, right? The person will have pain and restricted movement due to problem in the bursa. You see, this is a ligament, and this is the head of the humerus. So it rolls under the ligament and reduces the friction. Different types of movements. Now we'll talk about the movement. Now, as I mentioned already, that most of the cases muscles cross the joint, because we know that muscle moves the bones at the joint, so muscles must cross the joint. Just think that if a muscle starts here and ends here, it is no use because it is not crossing the joint. Make sense? Now if muscle starts here and ends here, when this muscle will contract, it will move the joint. Make sense? So muscles cross the joints, otherwise it will not be able to act. For example, this is a muscle starting here in this bone and ending on this bone. So this is the muscle, and the end attached to the bone which is fixed, this is called the origin. So this bone is fixed bone, and the end attached to the bone which will move, this end of the muscle is called insertion. Origin and insertion. So muscle has how many ends? Two. The end attached to the fixed bone, that is the origin. The end attached to the bone that will move, that is the insertion. Make sense? Now, tell me, this is a muscle here, your biceps, biceps, Okay, so this muscle goes like this, and I'm moving my forearm towards my arm, okay, like this. So which bone is moving, which part is moving, forearm or arm? Forearm is moving towards the arm, right? But this bone is fixed. These are moving, right? So this muscle has two ends. This end is origin or insertion? Origin. And this end is moving, right? So this is the insertion. Insertion move towards the origin. Make sense? So that causes the movement. Okay. Now, the movement could be in different planes. The main planes of movement are transverse, frontal, and sagittal. So those are the main planes of movement. That's easy. You must remember we talked about different planes in the lab part. First lab, remember that? Which plane is this? Sagittal. Make sense? Okay. So now if I move my body in this plane, that is called sagittal plane movement. For example, I am moving my head. Okay? Look at my head. Make sense? So this is sagittal plane movement. Make sense? Of my head. And this way is called coronal or frontal. Remember that? So if I move my head like this is coronal or frontal plane movement. Make sense? This way. And another is transverse, right? Parallel to the ground, like this. So if I move my head like this is transverse plane movement. Make sense? Like this. So this is what? Sagittal. This is coronal or frontal, right? And this is transverse. Make sense? Okay. Now look at my upper part of the body. This is what? Sagittal. This is frontal, right? Or coronal. And this is transverse. Make sense? Transverse plane movement. So those are the main planes of movement. Now, in a synovial joint, different types of movement can occur in those planes. We'll talk about different types of movements. Gliding. If the ends of the bones are flat, like this, you see flat, if both ends are flat, like this, what happens? The movement occurs between two flat surfaces like this. Make sense? Two flat surfaces, movement is possible only like this. Make sense? And that is called gliding. Where it happens? In your carpal bones. You know short carpal bones here? Like this. This is one carpal bone, this is another. This kind of movement occurs. Okay? Small. That's gliding or sliding type movement between two flat surfaces. Angular movement. There are different types of movements where the angle changes. Look at this. This is elbow joint, right? You know that this is elbow. And look at this angle. It's getting bigger or smaller? Smaller, right? And now bigger. So smaller, bigger. The angle is changing, right? So when I move this way, the angle is getting smaller, and that is called flexion. Make sense? Flexion. Where we talked about flexion, when we talked about actin myosin, remember that? Head flexion, right? So angle gets smaller. Flexion. Opposite of flexion is called extension. Okay? So the angle increases, opposite of flexion. Now you look at me. I'm moving my head, and look at this angle here. Getting what? Smaller. So flexion of my head, right? Make sense? Now getting bigger, right? So extension of my head. Is it clear? And this is the anatomical position, you know that. Head is straight, right? Now, if I ask you after you do flexion, then extension going back, if I ask you to do more extension from here, I can do that, right? Make sense? So that is called hyperextension, beyond the normal position. Hyperextension. Now you tell me, again go back to this one. Elbow joint. This is what? Flexion of forearm, right? Because this part is moving. And this is?
Extension.
Can I do hyperextension here?
No.
No hyper, because it won't go beyond that, right? So in some joints you have hyperextension. In some joints you don't have. Look at another example. This is, look at this angle between thigh and your trunk. Getting smaller, right? So this is flexion of the thigh. Make sense? This is what? Extension of the thigh. This is hyperextension. Okay, so here we can do hyperextension. Abduction, adduction. Have you heard the word abducted? Very often, right? Read in the newspaper, the child has been abducted, right? Or someone has been abducted. So that means what? Taken away, right? Taken away. So look at my arm. This is the anatomical position, right? I'm moving my arm away from my trunk, right? That is abduction. And opposite of abduction is what? Adduction. Bringing towards the body. Taking away from the body, abduction. Bringing towards the midline or body is adduction. Also, this is angular. Why? You look at this. This angle is getting bigger, right? In abduction, this angle. In adduction, getting smaller. Make sense? So this is also belong to angular type movement. Circumduction. If I ask you to draw a circle, the movement occurs in the joint, that is called circumduction. Okay? So I'm drawing a circle here, right? So in my shoulder, that movement is called circumduction. Is it clear? Have you heard the game called cricket? It's like baseball, but in baseball we throw like this, right? In cricket, you must do circumduction, like this, circle. You can't like do like this, okay? You have to do throw like this. So that is what? Circumduction. Make sense? Special rotation. Rotation is the movement in which the axis does not change. For example, you see I am moving this. This is the axis. It is moving around the axis. It's not changing. The axis is remaining there, right? You see this is the axis. In flexion, the axis changes, right? Extension, axis changes. Abduction, axis changes, right? But in case of rotation, the axis will remain like this, and around the axis, the body part will move. For example, this is called rotation. The transverse plane movement is what? Rotation. Make sense? Because if I put something through the head like this, it will not move. It will stay there. Make sense? Around that, the head is moved. Like this. Make sense? So rotation. You have a vertebrae, first cervical vertebrae, atlas, and second is axis. When you will see the bone today, see in C2, second cervical vertebrae, you have a dance like this, a finger-like structure like this, and goes like this. Okay, and now axis moves like this, around this. Sorry, atlas moves like this, and this is the axis. Okay, so axis doesn't change. So that is rotation. In circumduction, axis changes. Look at this. Circle. When I move in circle like this is the axis changing, right? In rotation, axis is not changing. Make sense? This is rotation, this is circumflexion. Okay. So, special movements in synovial joints. In some synovial joints, you can do supination, pronation. For example, this position of your arm is called what? Supine. Okay? Lying like this, supine position. When you lie on the bed like this is supine position. Make sense? Okay, so your upper limb is in supine position now. And when you move like this, you see the palm is facing now downwards, right? That movement is called pronation. And going back to supine position is this, right? This is called supination. So this is what? Pronation. And going back to supine position, supination. Make sense?